Welcome back. According to the CDC, about 795,000 people in the U.S. suffer a stroke each year. Stroke is the third leading cause of death here in the U.S.
And that's why today we have emergency room physician Dr. Ziyad Khesbak from Dignity Health California Hospital. He's joining us with some important tips on what we should know about stroke. Great to see you.
Great to see you too.
Thank you so much for being here. Let's get right to it. Golden hour of the stroke. What does that mean?
Yeah, golden hour of a stroke is our best opportunity to save brain, and they say time is brain, right? And an ischemic stroke is when the artery that feeds blood to the brain gets cut off, right? And we have an opportunity to replace that flow and get blood back to the brain. It's important for us to present to an emergency department that is stroke equipped as soon as possible. Some folks may want to go to their doctor and some folks may want to walk into their closest ER, but the truth is not every ER is appropriately equipped. So you want to call 911 and EMS will arrive, perform an appropriate evaluation and take you to the center where you need to be.
All right, what are the signs that you should look for yourself and your loved ones should look at when you're having a stroke?
That's an excellent question. So to identify the signs of a stroke, all we have to do is be fast. B-E-F-A-S-T. B stands for balance or dizziness, that's sudden in onset. I stands for eyesight, so difficulty seeing out of one or both eyes or difficulty seeing in our peripheral vision. F is for face, which is facial droop, weakness on one side of the face. A is for arm, which is weakness of one arm. S is for speech, which may mean difficulty finding words, difficulty making words, or difficulty speaking at all. And T is for time to call 911.
What if you're by yourself?
If you're by yourself, it's a good question. You want to get to a telephone as soon as you can. You want to go outside, maybe you want to find the closest person you can and indicate that you're having some kind of trouble, and hopefully they can call 911 for you.
Right. All right. And then there are risk factors, obviously.
There are risk factors for a stroke. There are some things that we can't control, like age or family history, but there are some things we can control, like diabetes, high blood pressure, cholesterol, smoking, sedentary lifestyle, intake of red meat, things like that.
Okay. You know, it's the fifth question here. You roll that up just a little bit. Recently, California Hospital downtown expanded the ER, the trauma services. They got a new tower just to treat stroke patients, correct?
Not just to treat stroke patients. Unfortunately, we've had some closures in the area of different hospitals and different birthing centers. And so we have a brand new tower that features not only a brand new emergency department with 6 brand new trauma bays in order to expand our trauma services, 47 beds as well to treat our patients, and floors for prenatal, postnatal, and neonatal ICU. So we're very excited to help treat our patients in this new environment.
We talked about some of the risk factors, but what can we actually do to reduce some of those risks?
Yeah, so I think there's things like quitting smoking and replacing red meat with things like white meat or fish that can be very helpful. A lot of times these things, in addition to regular exercise, can help improve diabetes, high blood pressure, and cholesterol by themselves. But of course, we should go to our doctors and receive medication if possible to help lower those risk factors.
Why red meat? Well, how does that affect the stroke?
I think red meat has a high content of saturated fat, and strokes occur when plaques build up in our arteries, right? And so reduction of the red meat prevents those plaques from building up and ultimately bursting, causing blood clots.
All right, doctor, good information.
Yeah,
thank you,
we're impressed with your job.
I'm impressed with yours.
And thank you for what you do.
Thank you.
Yeah, we appreciate it.